Hi everyone, I'm Zinat Begum. I'm a humanitarian professional. I have worked in crisis settings across Asia, Africa, and the Middle East. I care deeply about supporting affected population, both through hands-on fieldwork and strategic support. Today, I will talk about my leadership project as well as my journey, and it would be kind of a reflection. First, I will talk about my project. The title of my leadership project is Advancing Women's Health and Social Cohesion in Displacement Settings, Lessons from the Rohingya Refugee Response. I chose this project because displacement is no longer a temporary situation, it's a long-term reality for millions of people. About two-thirds of refugees flee to neighboring countries, and more than 70% of global refugee population is hosted by low and middle income countries. These are countries where communities are already struggling with limited resources, weak health system, and economic pressure. When large refugee populations arrive in these settings, host communities often experience additional strain on healthcare, livelihoods, water, and basic services. Over time, this pressure can lead to frustration and tension between refugees and host communities, even though both communities are equally vulnerable and trying to survive. This is a reality in Cox's Bazar, Bangladesh, where nearly 1.1 million refugees live alongside Bangladeshi host communities. A recent study comparing healthcare access between Rohingya refugees and host communities highlighted potential risks for conflict. Camp-based health services have improved health outcomes for refugees, but it is not the same for the host communities. These differences matter. They shape perception and influence social cohesion. I chose to focus on women's health for a reason. Women's access to care reflects equity, dignity, and the overall health of the community. This project asks a simple question: how can health program be designed so refugee and host communities are treated as equal partners, not as competitors for limited resources? By looking at community-led approaches, this work explores how inclusive health program can reduce tension, how they can build trust, and how they can support peaceful coexistence. I cannot talk about this project without talking about my journey in 2025. This year tested me deeply as a leader, as a professional, and as a person. At times, my very existence as a woman from a developing country, who later became part of one of the most advanced countries, felt questioned. The final day of this leadership immersion was also my last day at an organization where I provided strategic support for humanitarian work. I didn't allow that moment to define or diminish my leadership. I tried to remain focused. I reached my lowest point in September and October when I lost interest in almost everything. Yet, as reflected in my leadership competencies report, I continued to demonstrate resilience. I adapted and adjusted continuously. Even for this project, I had to rethink. The project idea that I submitted during my application process was no longer feasible as I was no longer part of that organization. Then I thought to collaborate with others and focus on country resilience in the context of funding cuts. That was also not possible due to my personal situation. Then I have come up with the new ideas which I have just shared. So it demonstrated my resilience, and without that, I could not be survived or I could not continue to move forward. The journey would not have been possible without this cohort support. Some of us who were laid off from the job search council, it became a space for care and connection. The mentoring sessions were the most influential aspect of this leadership journey. The journey also showed me where I need to grow, my ecosystem mindset, and my leadership presence. I'm actively working on them. What this experience confirmed is that authenticity is my core strength. Through this project, I hope to bring forward recommendations and approaches that addresses the needs of both refugees and host communities, and that contribute to social cohesion and shared resilience. Thank you, everyone.